In front of me here is over $100,000 in gold and silver. Now, if you think I'm flaunting my riches, you're wrong. I brought in these pretty shiny objects to make a point that dentists like you are costing yourselves just as much money, and you don't even realize it. And that point is that it doesn't matter how brightly you shine if you look just like everybody else. Stay tuned. I'm Colin, receiver, and this pile of gold and silver is worth over $100,000. Now, there's a lot of valuable objects here, and each object has a value because we've agreed on it, because the market has set the price for it. The market has said that this Krugerrand, this 1 ounce of gold, is worth exactly the same as this Krugerrand. These two coins have exactly the same value. Now, there's not a single reason to pick this coin over this coin, because in our minds, they're identical. They're worth the same. They're identical in every way. No, they're all pretty and shiny, right? And they're all commodities. So it makes no difference which coin or which bar you choose. Now, the public, your dental prospects, they see you in this exact same way. They see dentistry at large in the exact same way. They see every dentist as equally competent. One dentist is just as good as another in their minds. So dentists at large are viewed as a commodity. Now, if you fall into this commodity bucket, as most dentists do, there's really only two choices. One is you can sell out by devaluing yourself, and you can discount your work and offer specials and freebies. You can tell your prospects that they can get their gold coin or their silver bar for less money. Now, there's several problems with this approach, including the fact that it's hard to stop being known as the cheap dentist in your town. You may get lots of patients, but the average case value won't be great. You'll have patients that come in and want extractions, and they might say stuff like, "Does my insurance cover this?" You and your staff will end up working longer and harder, and that takes a toll on everybody. Now, I don't think any dentist goes into dentistry to want to become known as the drill and fill king or queen. So if you're not going to sell out and you're tired of working yourself to death, you've got to change the public's perception of the value that you provide. You have to position yourself as the only logical expert to solve their dental problems. And when you do that, you move yourself out of that commodity category. You're not just another dentist. You've taken yourself and put yourself as the preferred dentist in the minds of your prospects, the only logical choice. Now, that's what my company, SmartBox, has done for more than 550 dentists on 3 continents. We make them the best and the only logical choice for their dental prospects. And they attract not only more patients, but better patients. With higher case values, our dentists and their staff don't have to work as hard unless they choose to. Take Dr. Tom Fader as an example out of Illinois. He basically ignored marketing for the first 40 years of his career. It wasn't even looking like he was going to be able to retire. When he signed on as a SmartBox dentist, everything changed for him. He said, "Our average case value has increased since working with SmartBox. People are coming in looking just for dentures and implant work. We're actually overwhelming our local dental lab." In fact, Dr. Fader is enjoying a 2,210% return on his marketing investment. For every dollar Dr. Fader puts into his patient attraction system, he gets $22 back in his pocket. He's down to working just 3 days a week, and he wants to cut back even more. So like Dr. Fader, if you too want more profits, more patients, better patients, and ultimately more freedom from your practice, consider this message. Good luck, and keep moving forward.